Dear friends, I am Dr. Thompson Ntuba Akwo, certified professional and expert in global health. Certified and professional expert in global health USA. Subspecialized in medical communication or health communication. Today, I am giving you updates on global health outreaches. Over the years, our work has focused on global health outreaches, global health diplomacy, and global health development. So what have we been doing around the world in the area of global health outreaches? It's been very much. For over 10 years, we have worked with specialty organizations in healthcare in the USA. I personally have been credentialed after vetting and acceptance to work with the American Pediatrics Association, the American Pharmaceutical Association, the American Dental Association, almost all the major medical associations in the United States. So for over 10 years, I have been to many cities, many hotels, many convention centers, many venues where we have been given office space and have worked for a week and or more, as the case has been in that area. And I would want to underscore the importance of the medical specialty associations in global community health. They don't only do refresher courses for the experts and consultants in the specialties, which are part of the recurrent formation and renewal courses and recertification. They also have certificate courses in certain areas, and many professors and experts of those organizations are part of the teaching faculty that credentials the fellows. The American Pediatrics Association, in the annual convention, or some of them call them Congress, have special summits, which are specialized summits to address specialized problems in those fields. The American Pediatric Association has a summit specifically for global health, where they look at child health and child survival issues in global health. And pediatricians who are experts, some of them are trained in epidemiology, the determinants, distribution, the social determinants, the risk factors, and then they get into the epidemiology of promotion and protection, prevention work, and all of that. So we see that the American Pediatrics Association has been very much involved in that area. And I've had the opportunity of working with them and being part of questioning the professors and producing health and or medical or medcom resources for global consumption. And so in healthindevelopment.com, healthnancydevelopment.com, www.healthnancydevelopment.com or healthanddevelopment.com, we have the global health section that actually shows these resources under the pediatrics or child health and survival section. Some of the discussions have to do with immunization of children against preventable childhood infectious diseases, nutrition, malnutrition in childhood, and related to reproductive maternal health, the antenatal care of it, the delivery, and the postnatal care of it. I was very fortunate to be a senior medical officer in a teaching hospital where I worked rotating in different departments: pediatrics, general surgery, OB-GYN, obstetrics, gynecology, internal medicine, psychiatry, community health. And I remember our outreaches in community health, which took us to different communities out of the major city where we worked. And that gave me an opportunity to see firsthand the problems of particular communities, how to do community disease outbreaks analysis and community health analysis, how to do community engagement, mobilization, participation, partnership in global health issues, promotion. I work in the area of HIV/AIDS, malaria, tuberculosis. It wasn't basically sitting there and clacking people with respiratory problems, whether they presented with cough, and if the cough was productive or not, if the cough was related to chest pain or not, and if it was productive, what was the nature? Was there blood? And that helped us in the history taking to have a differential diagnosis, or a list of differentials, or what we'll call the possible causes of those symptoms, out of which we looked at the priority ones and then did investigations like acid-fast bacilli studies of the sputum, chest x-ray, culture, which gave us definitive diagnosis of what we're dealing with. And then when the diagnosis of tuberculosis was made, we knew that we were going to do tests for HIV/AIDS because we had begun to see a resurgence. We had begun to see a resurgence of TB in HIV/AIDS conditions because the bacterium itself could just be latent in the lungs, waiting for some form of an immune depression for it to blossom into a full-blown TB. So, I know there are people who don't know that there could be generalized TB, there could be TB of the GI tract and other systems, but I want to limit myself to TB of the lungs, the respiratory tract. The American and Thoracic Society, with whom I have worked also in a national meeting in Washington, D.C., getting out of our offices to meet with the consultants and fellow physicians as specialists in health and medical communication. The pulmonary aspect of tuberculosis were also discussed. That is all part of global health because TB is a global problem. Even though, as I said, there is a resurgence in predominantly places where we have a high endemicity and prevalence of HIV/AIDS, especially in the Africas and parts of the Americas. Then there is also the relationship between HIV/AIDS and drug addictions, what we call SUDs, substance use disorders, behavioral addictions like gambling, sex addictions, and related things. People who are sex addicts may mistakenly go without having condoms and obviously will come up with HIV/AIDS. Those who are intravenous drug shooters could share needles with people who are infected and then contract the HIV/AIDS virus that over time will lead to full-blown AIDS. So there's that relationship that is related to our work in substance use disorders, addictions, and recovery. So I was still talking about child health and survival as a component of our global health work. And I introduced maternal and reproductive health because there seems to be a continuation from reproductive health as it relates to the mom. Just imagine a woman gets pregnant today and then the zygote begins to develop and goes through these changes where the cells begin to divide and then differentiate and get into different groups which specialize into the production of different cells and tissues and organs that make up systems in the body. So a good example is the respiratory system, the cardiovascular system, the gastrointestinal system, the the renal system, the reproductive system. The reproductive system is a little bit different from a male to a female, but we still call it a reproductive system because it has different organs and tissues that come together to bring about specialized functions, activities within that system. The ovaries, the fallopian tube are all organs of their own within the reproductive system of a human, right? And they do different things. The uterus is an organ, and each of them could have an infectious disease condition that affects it independent of the other. There could be cancer of the ovary, of the uterus, the fallopian tubes, you know. So, but all those organs, of course, are organs of the female reproductive system. So part of our work is with women under the heading of maternal and reproductive health. With maternal health, we are looking at, because there is the measurement and analysis in global health, we talk about the QALYs and the DALYs, the disability adjusted life span and the quality adjusted life years. The disability adjusted life years, the quality adjusted life years, maternal mortality, related things. What is it that makes a woman to die? In some countries, we have a very high proportion of women dying within a certain population of 1,000 women. The number could be so high as 100, 500, one, you know. So if you have 50% of women of reproductive age who die because of reproduction, that's not good. So we look at that, as I said, we look at infectious diseases, we look at reproductive maternal health. So with maternal health, we talk about antenatal care. So when they come, you know, and they are under a process, we call it mesencesis or gestation, that's they are pregnant. There are examinations and histories that we take in the antenatal clinic, and then there are also immunizations that we give, like antitoxoid and related things. And when we are doing that, we are also looking at the baby, because we will transition from the baby in the womb to the first few days after pregnancy or postpartum, that we'll call the neonate. The first 4 weeks or so, the little baby is called a neonate. And we take very particular interest at that time, because there are lots of babies who die then. We're interested in food and nutrition, because, as I said, there are nutritional problems, you know, there are diseases which are related to water and things like that. We look at climatic conditions, the effect of the climate and the environment, the impact that it has on the health of the people. Today we are talking about climate change, global warming related things, droughts and flooding and hurricanes and fires, and their impact on families, people running away, homelessness, health problems, you know, lack of jobs because of internally displaced people and all of that. So that's one of the areas that we work. We also work in the area of immigration, and because we know that people who are internally displaced have immigration issues, and they may be refugees, and they have health problems, they may need vaccination and food and related things. So we work in that area under environment and climate. So in a nutshell, you will see us out there working in this area. We may be in disaster areas, we may be in conferences, HIV AIDS, the international AIDS conferences that I have worked with, and other international meetings that we come in. That is part of our outreach work, besides the global health campaigns and outreaches that I do around the world. So I want to thank you.